from our studios in downtown Salisbury. This is 47 ABC News at 12:30.
So September is Prostate Cancer Awareness Month. My guest today, Dr. Manoj Jain, joins us to talk about the significance of the month as well as prostate cancer awareness, detection, and treatment. Good afternoon and welcome. Thanks for being with us.
Thanks for having me.
So first off, let's talk a bit about how you're a certified radiation oncologist. How does that fit in with prostate cancer and what you do a bit?
So radiation oncology is a field that we treat prostate cancer amongst other cancers. Radiation therapy is a commonly used form of treatment for men who have prostate cancer. September is Prostate Cancer Awareness Month, and this is just so people are aware of this disease. And I urge them to go see their doctors and be aware of the signs and symptoms related to this type of cancer.
Now, speaking of, what are symptoms? What should men be looking for?
That's a great question. A lot of men who have very early stage prostate cancer have no signs or symptoms of the disease. However, men who have more advanced cancer often have urinary symptoms. They may have difficulty urinating. They may be getting up more often at night. Sometimes they may notice even blood in the urine. On rare occasions, men who have advanced prostate cancer can have bone pain in their hips and their spine. So these symptoms are not specific to prostate cancer, so there are other diseases which can mimic the signs and symptoms of prostate cancer.
So risk factors, are there things that men can do to maybe prevent it? What are some of the risk factors?
Well, there are some things which we can't change, which is the normal effects of aging. There are very few men who are actually diagnosed with prostate cancer under the age of 40. As men get older, their risk of developing prostate cancer increases. The average age that men are diagnosed with prostate cancer, according to the American Cancer Society, is about 66. So age is a risk factor. Family history is a risk factor. If you have a close relative like a brother or a father who has prostate cancer, you are more likely to be diagnosed with prostate cancer. Ethnicity is believed to be a risk factor. Often African American men have a greater chance of developing prostate cancer and presenting with more aggressive disease than white men.
Okay, and 15 seconds, what are some early screening methods available?
There's a very easy test for checking or screening for prostate cancer. It's a simple blood test called the PSA test. PSA stands for prostate-specific antigen. It's a simple blood test where they can check for this chemical produced in your prostate called PSA, and if the PSA is elevated, that may be a very early sign that you may have prostate cancer. Your primary care physician will also do digital rectal exams where sometimes you can feel the prostate and tell if somebody may be harboring prostate cancer.
All right, and bottom line, see your physician.
Absolutely.
And have your checkups.
Be aware and get checked.
Thank you so much, Dr. Jain, for joining us this afternoon.
Thank you for having me.
All right, we'll be right back with the Family Health Report. Stay with us.